kids scrolling social media right now. Are you? A lot of people are. Well, the U.S. Surgeon General says the mental health crisis among our young people is being driven by social media.
Yeah, this really shouldn't come as a major surprise to anyone. And now he is calling for intervention and regulation when it comes to kids and the use of the many platforms online. Senior health correspondent Monica Robbins joins us now to explain all of this. Mon, this feels like this has been a long time coming.
Oh, yeah. I mean, everybody knows. And what we're looking at, too, is the last decade of mental health issues. And everybody wants to easily blame the pandemic. Not so fast.
It was already underway before that.
Exactly. So up to 95% of 13 to 17-year-olds report using social media, and nearly 2/3 of teens say they use it every single day. Well, the U.S. Surgeon General released a report this morning outlining the fact that we really don't know the mental health impact social media use has on our kids. So we really can't even say if it's safe. We do know cases of kids dealing with depression and anxiety is up significantly. Some would say skyrocketing. The CDC citing 42% of teens report feelings of sadness and hopelessness, and it is far worse for girls, 57% reporting negative feelings. Dr. Vivek Murthy says it is time policymakers and the tech companies step up and share the responsibility.
I think the data has been telling us more and more clearly that there are significant numbers of kids who are harmed by their use of social media. I think what we need are safety standards and requirements around data transparency, and those actually have to be enforced.
Exactly. Murthy also believes we need age-based regulations that also need to be enforced. He says it's unfair that parents shoulder all the responsibility for protecting kids when the industry uses algorithms to essentially make social media addicting. And I know every adult out there knows exactly what I'm talking about. Studies show kids who spend more than 3 hours a day on social media face double the risk of mental health problems, including depression and anxiety. And that is really concerning because surveys show that the average time a kid uses it is 3.5 hours a day. Coming up at 5 and 6, I'll talk about the things you can do for yourself and your kids to help break free.
Well, it's hard to keep up too with like what's the hot app of the week. You know, it changes so often. So what are the apps that the kids are looking at?
Kids are mainly using TikTok, Instagram, and Snapchat still. You know, again, but this is not a new issue. There are some states already filing suit against these social media companies for targeting children and not enforcing their age limit requirements.
And what's crazy to me is I know they already have age limits and requirements, but it's like the honor system. Are you 16? Are you 18? Well, of course they're going to say yes. They're going to put a fake birthday down and then they're in and they're going.
You're right. And the age limit is actually 13 for the majority of these sites. But kids are more tech savvy than we are. And many, again, like Jay said, are starting accounts earlier if they have access. The other issue is 13 too young to be exposed to a lot of these things on social media
I agree,
impact their mental health. And I asked you about, you know, Josie, and something else. A lot of my friends with teens, they all have their social media accounts or their phones connected to their kids, so they know exactly what their kids are doing.
Yeah, you can shut them down.
But kids are smart. How do you know if your kid didn't start an account with a different name?
Right.
I know.
You know.
And just because they may not be logged in on one type of social media doesn't mean they're not looking at that social media. You can definitely get on and scroll through.
What's crazy is
time.
We know it's detrimental. We know that it's unequivocal. There's mountains and mountains of research. We're waiting now for guidelines.
Somebody has to do something.
Someone has to step up and give us guidelines. Okay. Monica, thanks.